In this procedure, you will learn how to prepare and administer an intramuscular injection. Read the provider's order and clarify any questions with the provider. You should never dispense or administer a drug without making sure the provider's order is legible and the details of the drug are known. If you are unfamiliar with the medication, refer to the PDR, online drug reference, or package insert to determine the purpose of the drug, common side effects, typical dosage, and any pertinent precautions or contraindications. Be prepared to answer any questions the patient may have about the medication. Use the 7 rights to prevent error. The right patient, the right drug, the right dose, the right route, the right time, the right technique, the right documentation. Perform calculations needed to match the provider's order. Confirm the answer with the provider if you have any questions. Dispense the medication in a well-lit, quiet area. Assemble the required equipment. Choose the correct syringe and needle unit, depending on the site of administration, patient characteristics, and the amount of medication to be injected. Before you dispense the medication, sanitize your hands. Compare the order with the label on the vial of medication when you remove it from storage. Check the quality of the medication and the expiration date on the container, and dispose of the medication if it appears contaminated, contains sediment, or has expired. This is the first of 3 label checks. Examine the label on the vial of medicine again just before dispensing the ordered dose. Make sure the strength on the label matches the order, or that you dispense the correctly calculated dose. Clean the top of the vial with the alcohol wipe using a circular motion. Place the vial on a flat surface. With the needle cover in place, grasp the syringe plunger and draw up an amount of air equal to the amount of medication ordered. Remove the needle cover. Hold the vial firmly against a flat surface and insert the needle into the center of the rubber stopper. Careful that the needle touches only the cleaned rubber area. Inject the aspirated air in the syringe into the vial, making sure the needle is not in the liquid. Keeping the needle in the vial, pick up and invert them. Slowly pull back on the plunger with the unit at eye level and draw up more medication than ordered into the syringe unit. While the needle is still in the vial, check for air bubbles in the syringe. If air bubbles are present, move the fingers holding the vial down to grasp the vial and syringe as a single unit. With your dominant hand now free, use it to tap the syringe until the air bubbles dislodge and float into the tip of the syringe. Inject the air bubbles back into the vial with the extra medication that was withdrawn. At eye level, make sure the accurate amount of medication is in the syringe unit. Withdraw the needle from the vial and carefully replace the needle cover without letting the needle touch the outside of the cover. Return the medication to the shelf or the refrigerator, checking the order against the label one more time to complete all 3 label checks. Prior to entering the exam room, knock on the door and give it a moment. Greet the patient and identify yourself.
Come in.
Good morning, Tina.
Good morning.
How are you this morning?
I'm good. How are you?
I am good. My name is Tori. I am Dr. Shyman's medical assistant. I want to verify a few things with you.
Okay.
Can you give me your name
It's Tina Lakin,
and your date of birth?
4/21.
Verify the patient's identity with her full name and date of birth. Make sure the patient's information matches the order and the record. Provide the right education to the patient. Explain the medication ordered, provider ordering the medication, the desired effect, and common side effects. Answer any questions the patient may have. Use language the patient can understand. Ask the patient if he or she has any allergies.
Tina, how you feeling today?
Not feeling very well.
Okay, Dr. Anderson has ordered a penicillin injection for you today, and that should allow you to feel better and get rid of the infection, okay?
Okay.
Do you have any allergies to medications that you know of?
If the patient refuses the medication, respectfully ask the patient the reason and notify the provider. Sanitize your hands again and put on gloves. Loosen the cap on the needle so that you'll be able to open it with one hand once you clean the injection site. Open the alcohol wipe. Find the site using the landmarks. Cleanse the patient's skin with the alcohol wipe using a circular motion and moving outward from the center. Use some friction to help clean the site. Create about a 2-inch circle at the site. Let the site dry. Place a gauze square between your index and middle finger of your non-dominant hand. To compress fat and stabilize the muscle, place your non-dominant hand on the patient's shoulder. With that hand, use your index finger and thumb to pinch up at the cleansed area. Hold a gauze square between your index and middle finger of your non-dominant hand. And with the thumb and first 2 fingers, spread the skin tightly and grasp the muscle deeply on each side. Hold the site. Pick up the syringe and tip it to remove the cover. Hold the syringe like a dart in your dominant hand. Quickly and smoothly insert the needle into the site using a 90-degree angle depending on the needle size. Insert the entire needle. It is important to aspirate before giving an intramuscular injection. Check the barrel of the syringe for blood. If blood is seen, pull out the needle and discard. Then restart the procedure. It is important not to give the injection if the needle is in the bloodstream. If no blood is seen, inject the medication at a rate of about 10 seconds per milliliter. Ensure all the medication has been injected before pulling out the needle at the same angle as entry. Activate the needle safety device with one hand while the other hand covers the site with gauze. Gently apply pressure at the site to stop any bleeding. Apply a bandage if the patient requests it. Remember that some bandages may contain latex, which can be an allergen to some people. Some people may be allergic to the adhesive. Discard the needle and syringe in a biohazard sharps container. Make sure to put the needle in first. Observe the patient for any adverse reactions. Clean up the area. Discard all waste, including your gloves, in the biohazard waste container. Sanitize your hands. Document the procedure in the health record. Include assessments done, patient allergies, teaching or instructions provided, the provider ordering the medication name, dose, route, and how the patient tolerated the medication. Also include the manufacturer, lot, and expiration date for vaccines.